So today I'm going to be talking about ECT, or electroconvulsive therapy. Now you actually might have seen ECT if you've seen One Flew Over the Cuckoo's Nest. Jack Nicholson's character gets administered the treatment during the film. It has changed since then. Now they use electropads placed on the scalp to induce a seizure, which, as they say, resets the brain. So ECT is definitely an expensive procedure. It will probably be covered by your insurance, but I would check to make sure if you are interested in it. For looking at it, it could be $25,000 for about 10 weeks, and then that could be an additional cost when you include a 1-week hospital stay. So at this point, I think it's important to discuss non-dominant unilateral ECT and bilateral ECT. Now, with bilateral ECT, memory issues started showing up about 24 hours after the 5th ECT session. Unfortunately, I have another story from a YouTuber called Ketamine Saved Me. She has a YouTube channel. I'm going to link it below. But in that video, she talks about after her 4th session, she started getting anti-retrograde amnesia. If you are seriously considering this form of treatment, I'd highly recommend you watch her videos. Not only that, you can see in the comments below people commenting on their experiences or experiences with loved ones. So I just want to say I have reached out to her. I don't know what type of ECT she was administered. I don't know if it was the non-dominant unilateral or the bilateral ECT. So I can't really speak on that. And I also can't speak on the comments that she received on the video talking about how negatively ECT has impacted their loved ones. Now, I do want to say that there are some good, I saw a good comment about how ECT saved somebody's life, but again, I don't know if that was the non-dominant unilateral or if that was the bilateral ECT. So it's just I don't have all the information to provide you. I did reach out to her and ask her if I can use her footage. She never got back to me. She hasn't been active on Twitter and she hasn't been active on her YouTube page. So I'm not sure if I'm going to get that response. But if I do get a response about that, and then also if I get a response from her regarding if it was bilateral ECT or unilateral ECT, I will also be putting that as a pinned comment in the comments below. So this type of treatment is definitely one of the hardest for me to recommend, just because I know the severity after researching these comments and seeing her video. I just really recommend people to continue doing research if they think that this is a good fit for them. I would factor in, again, the non-dominant unilateral versus the bilateral ECT. So since ECT is kind of like a cousin to TMS, which will be my next video, that's why I wanted to discuss ECT a little bit and do some research on it. So as a disclaimer, I'm not a doctor. These videos are for informational purposes and to kind of get people started in doing their own research into these different types of treatments. I would recommend talking to your practitioner, if you're looking into ECT, the people who are going to be administering that treatment, and then also doing your own research. So I hope that this helps. I just want to say thank you for watching, and I will see you in the next video. All right, bye.